It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
And hi again, everyone. Jim Knox, along with, of course, Candace Kruger. And we welcome you back to another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area, Candace, that help change people's lives.
They certainly do. We're going to kick off the show today with a bariatric surgeon. It's Dr. Scott Stowers from My Bariatric Solutions.
I've experienced in my past excessive weight gain. I would diet, lose, gain, lose. I was embarrassed. I was ashamed. I didn't feel good, and the more I gained, the less I felt confidence. I had made the choice that I needed to really make the decision to change my life, to get my health back on track.
Charlotte had a lap band procedure, which is one of the most common procedures that we do. She's been very successful for her. She lost her predicted weight that she wanted to, and several different medications she took, she doesn't take anymore.
I decided to have the bariatric lap band at My Bariatric Solutions. I have a lot more energy. I strive to do things that I wouldn't have before, experience some exciting things on some of my travels.
A band is put in laparoscopically through small incisions in the skin. We put the band around the top of the stomach, and it's a balloon, essentially. It has a port that goes up under the skin, and we can put salt water in there and tighten the band up. That keeps the food in the top of the stomach and makes people feel not hungry with a small amount of food. It works like a long-term diet, only you feel full with small amounts of food. The most important part of a band patient doing well is frequent follow-ups and getting their band adjusted, especially early on. First 6 months, we will normally do about 5 adjustments until they learn how to use the band. After that, maybe one every 6 months, and then later on, maybe once a year.
My experiences with Dr. Stowers and his staff is so easy. I arrive, I'm seen in a timely manner, in a professional manner, and people are so friendly and they treat me as a family. Each time is very special, and I look forward to seeing the doctor. He's very friendly, very cordial, and very professional all at the same time.
Keeping your social networks alive and well may help benefit your ticker over the long term. Social support has been linked to a lower risk of heart disease, and people who do have heart attacks fare better if they're socially connected.
I had a condition called true gynecomastia, and the condition is basically a hardening of tissue in the chest area. And so unlike some of the other people that have that, it was actually hard tissue, it caused pain, and it was pronounced through clothing, things like that. It was more pronounced on one side than the other. And so that kind of began the search where I looked for doctors for about 3 years.
Gynecomastia is a very common problem for many men where they have the physique in their chest that's more female or feminine, and that's why it's called gynecomastia, feminine breasts on men. And obviously most men are not happy to have breasts, and they want to have that corrected. So they like to have prominent pectoral muscles, they like to show a lot of musculature, but they don't want to have breasts.
So I talked to my primary care physician, and then I started to look at different plastic surgeons in the Houston and the Dallas area. And without even examining me, most of the doctors would tell me the procedure right off the bat, and usually that entailed to do multiple cuts around the area, multiple incisions, and then go in and from all angles kind of, take out that tissue. So I knew that that wasn't something that I really wanted to do because it was going to leave a lot of scarring. So I put it off, and it ended up, like I said, it took about 3 years. And the first time I went into Dr. Zeus's office, he told me flat out, I'm going to, stay here until we answer all of your questions. And he kind of went beyond that. I mean, he came up with questions that I wasn't even thinking about. And within a few minutes, I knew he was the man for the job. I mean, he actually examined me before he made any recommendations, and then he kind of went through the whole procedure. And the procedure was going to be, 2 really small cuts, which I kind of didn't believe at first, to be honest, because I'd been told by so many other doctors that that wasn't possible, that they would have to do multiple incisions.
What we do is we take off the breasts by making small incisions under the areola, and through liposuction and sometimes excision as well, we remove the breast tissue and we give them better contour.
Now that the procedure's done, all I have is praise and thanks for Dr. Zeus. Without him, I would have probably gone to one of the other doctors and been unhappy with the results. My life has truly changed as a result of this procedure, and I would highly recommend it to other people.
For more information on any of the doctors you've seen on today's show, be sure to head to our website, bestdocsnetwork.com. And now we're going to check in with our next best doctor. It's pain management specialist, Dr. Jason Williams.
Well, Jesse came to me complaining of low back pain and leg pain. It had been plaguing him for several years and been progressively getting worse. It was to the point where it was affecting his job.
Every time I had a back spasm, I'd be out for 2 or 3 days where my back would hunch over for, I'd be stuck in this weird, awkward sideways position, hunched sideways. And every night when I went to sleep, I dreaded going to sleep because I knew I'd wake up in pain. Sure enough, it was a bulging disc on L4 and L5. Well, initially, and my doctor referred me to a spine specialist that he was familiar with and comfortable with. So I saw him for a while. I went in for cortisone injections. Went through that, went through physical therapy, and all of it helped, and it did help alleviate some of the pain, but it eventually came back. So the doctor recommended actually having some type of invasive surgery, and it was something I just really wasn't comfortable with. And luckily at that time, Dr. Williams told me about the Accuroscope procedure.
The Accuroscope procedure is a minimally invasive spine surgery that addresses conditions of the spine, including herniated disc, bulging disc, degenerative disc, and/or scar tissue in a patient's spine.
The way he presented it was, here are the facts, here's what's been done on other patients, and here's the proven success rate.
Oftentimes patients come to me, and they're in so much pain and have their extremities affected so much that they can't walk without using an assistive device. That'd be a wheelchair, a cane, a walker. Upon doing the Accuroscope procedure, a lot of these patients no longer need an assistive device.
When I woke up from the surgery, I knew that it had worked. There was this weird feeling of intense pressure gone from my back.
After Jesse had the Accuroscope procedure, he followed up with me, and I determined that Jesse's pain was 100% gone. I
have now been able to focus more on work, focus more on and enjoying my family, getting just good quality sleep. I've been pain-free for 9 months now.
As always, for more information on any of the doctors you've seen on today's show, or to even request an appointment, head to our website, bestdocsnetwork.com.
That is the place to go, thebestdocsnetwork.com. You will see everything you want to know about some outstanding doctors, including our next best doctor. It is Dr. Clay Cockrell.
the middle of nowhere. Sometimes people can be under stress and can develop. Sometimes people can get an infection, like sore throat, and they'll get what's called guttate psoriasis. You get a widespread eruption of lesions that develop, and usually that kind of goes away after a relatively short period of time. Most cases of psoriasis do tend to run in families. There tends to be a genetic relationship to it, so someone in your family tree probably had psoriasis somewhere along the way if you get it. Just like atopic dermatitis can be worsened by bacterial infections like staph and strep and things of that nature, psoriasis can too in some cases, and for that reason, in addition to using some of the things like the creams that we use to kind of slow down the growth of the skin, sometimes we use things targeted to try to get rid of underlying bacterial infections. So we'll even recommend bleach-containing washes in some cases, even for psoriasis patients, even though we don't think that's actually directly affecting the psoriasis. If they've got a bacterial infection that's making it worse, you get that better, the psoriasis will get better too sometimes. You do have it for your whole life, but the good news is there are treatments that can put it into remission, and some people go into long-term remission. They may have psoriasis that's really bad for a number of years. With good treatment, it may just go away, and then you can taper the treatment off, and it doesn't seem to come back for long, long periods of time. So it sort of behaves in different ways in different people, and we never really know for sure what it's going to do until we actually treat the person and get them into remission.
The Best Docs Network is all about doctors helping change people's lives. It's educational, informative, and real. Log on to bestdocsnetwork.com.
We've been using Preferred Imaging since 2001, since I started practicing here, and patients universally come back telling us what a great experience it was. I'm an orthopedic surgeon, board certified in orthopedic surgery and sports medicine. I do a customized knee replacement that is a special technique that is customized for the individual patient. So that knee replacement is based off of an MRI that the patient gets of their knee, their hip, and their ankle. And through that MRI, we feed that into a computer, and it creates a three-dimensional model of their whole leg. And that allows us to be much more accurate in the way that we do the surgery. So the MRI for that knee replacement technique is absolutely essential. It's a special MRI, and Preferred Imaging is specially certified and trained to do these special MRIs. Well, we love Preferred because they do a fantastic job for our patients. They get our patients in right away. They do a wonderful job at customer service and making sure the patient's comfortable through the whole experience, and really just guiding the patient from start to finish through that sometimes scary experience, and making sure that they are as comfortable as they can be. Well, MRI is a very integral part of an orthopedic practice because it's the best imaging test for musculoskeletal problems. So we use MRI quite a bit to establish a specific diagnosis, and that saves a lot of time and effort. You know, the quicker you can establish a diagnosis, the quicker you can get to the bottom of the problem and get it fixed. One of the greatest things about Preferred Imaging is that they have incredible hours, operating hours. They work from early morning till late at night and 7 days a week, and that convenience is an incredible thing for our patients because they don't have to miss work oftentimes, and they can get the MRI done right away, immediately, so that we get an answer to what's causing their problem, and we can get busy fixing it. We send patients to Preferred Imaging because we have full confidence in their ability to do a really good job for our patients, and they treat them well, and that reflects well on us.
Engaging in casual conversation with others may help keep you as sharp as doing a word puzzle. According to some studies, just 10 minutes of daily chatter appears to improve mental function and preserve memory.
Well, Mommy Makeover is a term that incorporates recontouring and improving the body, in particular after one or multiple pregnancies.
Over the past 6 years, I've lost a lot of weight and have had a baby and just had a lot of imperfections that I didn't like about myself that made staying healthy difficult.
What a mommy makeover incorporates is usually a tummy tuck, which tightens the muscles and the skin and removes the lower abdominal stretch marks. And oftentimes there may be loss of breast tissue from the pregnancy and subsequent nursing, or there may be drooping in addition, in which case breast augmentation or a breast lift or the combination of the two is done in conjunction with the tummy tuck. And then there may be need for liposuction as well, in, for instance, the hips or the thighs.
My concern is I work. I'm a working mom, so I knew I couldn't take off several months after each procedure. So that was a big concern of mine, and I'm a respiratory therapist and I work 12-hour shifts on my feet, so I had to be able to be active when I came back to work. That was a big concern of mine. So Dr. Wilcox explained how he would divide up the mommy makeover that would best fit my schedule and my lifestyle. He definitely put me at ease over everything that would be done and what to expect after it was done and how it would look.
Looking in the mirror and not liking what you see, how more impersonal can that be? And now to look in the mirror and say, I not only look good, I look good for my husband. That's a knockout there.
Even going to buy a new pair of shorts or a sleeveless shirt. I used to wouldn't wear short sleeves or a sleeveless shirt, and it's just a freedom that you have to go think something's cute, try it on, and it does look cute. I am very pleased with the outcome and service that I got from Dr. Wilcox, and it is the best outcome that I ever could have thought.
How can you tell when a lump is a bad lump or a not bad lump? And it's important to know because bad lumps can be cancer and not bad lumps don't need anything like biopsies and doctor visits. Here's how to tell if a lump is bad. First of all, is it rock hard? Benign lumps are usually soft or rubbery, and hard lumps like a rock hardness, those tend to be cancerous type lumps. Also, if the lump that you feel in your neck, for example, or your breast or in your armpit or on your leg, if it's fixed to the tissues instead of nice and mobile and movable, then that's a bad sign. Fixed lumps can be cancer. They aren't necessarily cancer, but they can be cancer. And if they're movable, they're usually not. This isn't a hard and fast rule, but in general. Also, if they're growing, cancerous lumps tend to grow. Non-cancerous benign lumps tend to stay the same size or get smaller. Also, you want to know if the lump is discrete, meaning can you feel all of it? Is it nice and smooth? Is it easy to feel the borders of it? That's a good thing. If you can't feel the borders of it, that sounds like it could be cancer because it's growing out into the tissues. That's a bad sign. If you ever have any question, see your doctor.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab. Welcome to the Best Docs Network. In the studio, we're very pleased to be joined today by one of the top LASIK surgeons, not only in the Dallas-Fort Worth area, but in the country, Dr. Harvey Carter. Dr. Carter, thanks for being with us today.
Thanks for having me.
It's a pleasure. And now talk to us about how you started in this field.
I chose this field of medicine because I loved microsurgery, and I found that out very early in medical school. And ophthalmology is an incredible mix of microsurgery, laser surgery, and wonderful, wonderful technology.
And you did your undergrad at SMU. Did you always plan to come back to Dallas to start your practice?
Yes, that was my goal. I came to SMU because of the pre-med program back in the time that we went here, and then went to LSU Medical School in New Orleans. Then did my internship back here in Dallas and residency in Georgia, and then back here to Dallas again. So I love Dallas.
That's great. And you have a lot of ties to the community, very involved in the Dallas community. You're the official LASIK eye surgeon of the Dallas Cowboys. That has to be both exciting and very rewarding.
That's been an incredible journey, and I sort of fell into that.
Really?
Went to a charity event many years ago. And while we were there were a number of Dallas Cowboy players there. And one thing led to another. And first, Tony Casillas' wife came in and had LASIK surgery. And then Tony Casillas came in and had LASIK surgery, and then I think it's like 50 or 60 cowboys over time came in and had LASIK surgery.
That's so fun. And what would you say sets your practice, Carter Eye Center, apart from other eye practices in the Dallas-Fort Worth area?
I really think it's personal service and high technology. Patients, I think, are looking for personal service, and at the same time, I think they're looking for high technology. They want the latest, greatest, they want the best.
For more information about any of our outstanding doctors you see on today's show, the good news is you get to head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com to check out other life-changing stories. Right now, it's time to introduce you to our next best doctor. It is Mohs surgeon, Dr. Patrick Walsh.
In our practice, we really emphasize patient autonomy. We feel it's very important, probably the most important thing we do. We want the patient to be involved with every step of the process in our office so that they understand the nature of their skin cancer, exactly what it is we're going to do in order to remove the skin cancer, and what their options are after the skin cancer has been removed.
I have had skin problems for most of my life. When I was young, I tried to always get a suntan, but instead of getting tan, I got sunburn, and then I would just peel off.
Reverend Turner is a fine gentleman who has very fair skin and has had a lot of time outdoors, and he's developed a lot of very superficial squamous cell and basal cell carcinomas, predominantly on his scalp. Once they're diagnosed, we've removed a number of them using the Mohs technique.
It's very effective. I'm glad that I can have his expertise in treating my problem.
Anyone that develops skin cancer should be seen by a dermatologist every 6 months. And that's because we know that skin cancer is due to exposure to ultraviolet radiation. And unless you have left the rest of your skin someplace else whenever you got sufficient sun exposure to get your first skin cancer, all the rest of your skin that was there is susceptible to the same mutations that gave rise to the skin cancers.
I'm 79 years old and I'm still here. He's helped me to get as old as I am.
Hi, I'm Dr. David Azouz with Best Docs Network. Did you know that there are 3 different breast augmentation implants that we now use? These include saline, silicone, or cohesive gel. If you want more information, please log on to bestdocsnetwork.com.
My specialty of prosthodontics really is the plastic surgery of dentistry. And in order to have a successful outcome, we want our patients to look beautiful and refreshed like the plastic surgeons do, but we don't want anyone to focus on why that is. And my specialty of prosthodontics exists because we make people's smiles as perfect as possible. We make people's smiles perfect with veneers, crowns, or implants. Each patient has a tailor-made treatment plan that we execute to give them the smile they've always wanted. It's very profound, the effect that teeth have on a person's facial structures. Part of the aging process is that people lose teeth or they lose bone, and that changes their facial shape, and it makes them age prematurely. So healthy, beautiful teeth support the face, and that is a part of what we try to do. For our patients who are missing teeth, we certainly want to give them back a beautiful smile, but part of the process is giving back the fullness and the youthful appearance from having the soft tissues restored as well as the teeth. During our diagnostic phase, we try to identify the problems with each patient's smile. Some people's teeth are too long, some are too short, some are too narrow, some are too wide. So there's a variety of ways that we can fix virtually every smile. And part of the specialty of prosthodontics is to know the modalities that need to be employed to fix each patient's smile and make it a custom, beautiful smile. My approach to these treatments is that I want to partner with my patients to create a breathtaking, functional smile. And the end result is life-changing for them. But what I love is it's life-changing for me too. To see their reaction and to participate in that, it's life-changing for me as well. I think most of our patients who go through a smile transformation have greatly improved self-esteem. And that's one of the most satisfying parts.
Find out more about your family history. Finding out what your grandparents died of can provide useful and life-saving information.
Well, I've kind of always wanted to have larger breasts, but I was married and my husband didn't want me to do it and had a bunch of kids. And so I had a life change. In the 90s, one of my good friends had used Dr. Barnett, and she goes, Kim, you're starting your life over, go see Dr. Barnett.
A breast augmentation is where there are several incisions. The only one that makes any sense is right here where the crease is. You make an incision, you open up a space for the implant to sit in. Very important to put it on top of the muscle. You make a space, you have already decided what size implant that they need. Why? How do you decide what they want, what they need, how big have they been, how big are they now, how tight is their skin? Or you make the operation fit the patient rather than vice versa.
Afterwards, I was here for hours recovering, and I had a friend take me home, and I slept through the night. Waking up, I had very little pain. After about 4 or 5 days, I was pretty comfortable in going and doing. I took a couple days off of work, and then I was back at work.
When Kimberly came in, she needed some changes in her life. She needed her breast done, or wanted them done, and she wanted a new figure. So that's what we did.
It's great. I love it. He did a great job, and I'm very happy with it.
Her breasts are fabulous, if I do say so myself, which I will. They fit her body. She told me a minute ago, she looked like she does now when she was 28 years old. And that's what we did for Kimberly. We just gave her a boost in self-esteem. She's happy. It's win-win all the way around.
Dr. Barnett was very personable, very funny and nice. And he takes time to know you, and he lets you know him. And so then you kind of have a relationship before the surgery. So you feel very comfortable and you trust him. And it was a great experience.
That'll do it. That'll wrap up another edition of the Best Docs Network, featuring, of course, some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives. And the good news is, Candace, for more information about any of our outstanding doctors, the folks can head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com.
That's right. You can even request an appointment. And if you have a question or comment for us, we'd sure love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.